Malaria is a dangerous disease. It affects millions of people worldwide, especially in poorer countries like Pakistan. This disease is a major health problem, causing illness and even death. Malaria is especially dangerous for young children and pregnant women. They are more vulnerable to its severe effects. In Pakistan, we have seen a rise in malaria cases recently. This increase is alarming. The floods in June 2022 made the situation worse. Stagnant water became breeding grounds for mosquitoes, which spread malaria. We need to understand this disease and take steps to protect ourselves. Malaria spreads through a tiny parasite called Plasmodium. This parasite lives in certain types of mosquitoes. When an infected mosquito bites a person, the parasite enters the bloodstream. Once inside the body, it infects red blood cells. This leads to the symptoms of malaria, such as fever, chills, and body aches. These mosquitoes thrive in warm, humid climates. They breed in stagnant water, which is common in many parts of Pakistan. Understanding how malaria spreads is crucial to preventing it. We must target the mosquito breeding grounds and protect ourselves from mosquito bites. Sindh, a province in Pakistan, is particularly vulnerable to malaria. Several factors contribute to the high number of cases. Floods, unfortunately, create ideal breeding grounds for mosquitoes by leaving behind stagnant water. Poor sanitation and limited access to clean water exacerbate the problem. Lack of awareness about malaria prevention is another challenge. Many people do not know how to protect themselves from mosquito bites or the importance of early treatment. Climate change is also playing a role. Rising temperatures and changes in rainfall patterns create more favorable conditions for mosquitoes to breed. Section 4. Protecting ourselves and our communities. Preventing malaria requires a multi-pronged approach. One of the most effective ways to protect ourselves is by using mosquito nets while sleeping. These nets create a physical barrier between us and the mosquitoes. Maintaining cleanliness in and around our homes is crucial. We must eliminate any stagnant water where mosquitoes can breed. This includes emptying containers, clearing blocked drains, and keeping our surroundings clean. Wearing long-sleeved clothing and pants, especially during dawn and dusk when mosquitoes are most active, can also reduce the risk of bites. Section 5. The role of individuals and households. Individuals play a vital role in preventing malaria. We must take responsibility for our health and the well-being of our families. Seeking prompt medical attention if we experience any malaria symptoms is essential. Early diagnosis and treatment are crucial for preventing complications. Householders have a responsibility to protect their family members, especially young children and the elderly. They should ensure that everyone in the household sleeps under mosquito nets every night. They should also educate their families about malaria prevention and the importance of maintaining cleanliness. Section 6. A collective effort combating malaria together. Combating malaria is not just the responsibility of individuals and households. It requires a collective effort. Communities need to work together to raise awareness about malaria prevention. We can organize cleanliness drives, distribute mosquito nets, and educate our neighbors about the importance of eliminating mosquito breeding grounds. The health department and the government have a critical role to play. They must provide access to affordable malaria treatment and ensure the availability of mosquito nets. They should also conduct regular awareness campaigns, particularly in high-risk areas, to educate people about malaria prevention and control measures. By working together, individuals, communities, and the government can significantly reduce the burden of malaria in Sindh and create a healthier future for all.